Chiropractic Explained to Medical Doctors. This year, I will dedicate a monthly blog to medical doctors on topics related to chiropractic that relates to their medical practices. Since doctors of chiropractic, DCs, are educated in separate universities in medicine, and that DCs do not work out of hospitals, there are few occasions for MDs to become familiar with their local doctor of chiropractic. So chiropractic in general, for that matter, is unfamiliar to them. I pray this blog will reach doctors focused on caring for their patients, that they look objectively at the information I will share to enable them to better serve their patients by understanding where a local DC can be of value to their patients. After all, we are both professionals in any given community dedicated to serving our patients. It is common to hear from a patient that their MD is opposed or resists to their use of chiropractic services. We know that even in integrated clinics, MDs rarely refer to to DCs. That is right down the hall from them, and we would think that that reflects a negative attitude, but it's much simpler than that. I manage some 30 chiropractors in 30 communities, and I see this all the time. What we do know is that an MD will refer to a DC when they have met them personally. What I'm saying is that when an MD is comfortable with a chiropractor that they know personally, they will refer some patients to them when the patient asks for a referral and when a case fits their understanding of what a chiropractor can do. And this does not mean that they are chiropractic converts, just that they know that this individual doctor well enough to feel that their referral will have a safe experience for their patient and not reflect badly on them for making the referral. Newer MD graduates may have had greater exposure to chiropractic as patients, because we know today that about 50% of American, Australian, and Canadian residents have received chiropractic care. So it's not uncommon for someone to have already visited a chiropractor before they made their decision to study medicine. These individuals know the local chiropractor is a professional, highly trained, effective in certain areas of healthcare. So once they graduate and they start seeing patients, this generation of MDs is more active in considering chiropractic care for their patients, simply due to their personal experience in countries where the chiropractic profession is not that well established yet. MDs there have not been exposed to much of anything on chiropractic, so they do not prejudge doctors of chiropractic, but instead are interested in learning more about this new profession. This respect is mainly given because of the training by the DCs that has taken place in Western country, a lengthy and extensive education that matters to learned people. That is today's reality. This blog honors those who serve humanity in caring for their patient in suffering and in supporting patients in their goal for a better, healthier life. So I'm starting this first MD-focused blog with the following message and appeal. Doctors, our community is blessed to have such well-educated and qualified professionals to serve in their healthcare needs in many health professionals. Medicine, dentistry, chiropractic, optometry, veterinary, osteopathy, just to name several. Now, if you have previously experienced chiropractic with positive, mixed, or negative results, please afford the entire profession the courtesy to remain objective in assisting patients in making their healthcare decisions by including chiropractic. Now, if you've never been to a chiropractor and have never been exposed to objective information on chiropractic profession, and you know what I mean, nothing discriminatory that has unfortunately surfaced all these years. Please reach into your sense of moral decency. Be patient-centered, not profession-centered, in your attitudes to professionals that have different training than you. Legislative bodies consist of people who represent people. So it is a significant matter that chiropractors are recognized, licensed, and regulated in the same way that MDs are held accountable. Thank you so much for taking the time to reach this far into my message. Yours in health, Doc Mike.